Drink more water. We hear it everywhere. It is one of our most ingrained health directives, pushing us to carry giant tumblers and constantly top up our intake, operating on the assumption that, when it comes to hydration, maximizing your volume is always the right move. For older adults, that blanket advice is scientifically flawed. Forcing excessive amounts of water is not a harmless habit. It actively damages brain health. A 2025 study from Japan outlines the mechanics behind this. It shows exactly how water alters the blood vessels inside the brain, why tipping into overhydration actually accelerates cognitive decline, and how to calculate a specific, individualized hydration formula to protect your memory. The challenge begins with the natural aging process. As we get older, our bodies lose total water mass, and our innate sense of thirst begins to dull. We become highly vulnerable to invisible dehydration, which is a major driver of cognitive impairment. Researchers at the Kakehashi geriatric facility tracked a group of elderly patients to see if fixing this dehydration would reverse cognitive decline. They measured daily fluid intake, monitored the physical flow of blood into the brain, and tracked cognitive performance over several months. This chart plots their findings, mapping daily fluid intake on the bottom against cognitive test scores on the side. The relationship is not a straight upward line. It forms a stark, inverted U-curve. Scores rise steadily to a distinct central peak, and then they plummet. Maintaining a sharp mind in your later years requires hitting a very specific biological threshold. You have to climb the curve without tumbling down the other side. Let's start on the left slope of that curve, looking at the patients who were drinking less than the optimal amount. As these individuals incrementally increased the fluids they drank each day, their performance on a global cognitive assessment known as the MMSE J showed a clear, measurable improvement. The researchers traced this mental boost to a physical change in cerebral hemodynamics, the actual mechanics of how blood flows into the brain. This animation shows the first major shift. Adequate hydration lowers vascular resistance. The carotid arteries relax, widening the internal plumbing for greater volume. With resistance lowered, blood velocity increases. The fluid moves smoothly and quickly, without forcing its way through constricted pipes. This fast, unresisted current of blood is exactly what the microvascular networks deep inside the brain tissue require to stay healthy and deliver oxygen to neurons. A glass of water physically dilates microscopic blood vessels in your head. It is a mechanical action that fuels higher cognitive performance. That mechanical benefit only holds until you hit the peak of the inverted U-curve. The study identified this sweet spot as approximately 42 milliliters of fluid for every kilogram of lean body mass per day. This diagram translates that formula into a practical target. For the average older adult, that peak is roughly 1,500 milliliters, about 6 standard cups of fluid a day. Consistently drinking past that 1,500 milliliter line pushes the body down the dangerous right side of the curve. This is the zone of fluid overload, and it is particularly hazardous for older adults dealing with underlying heart conditions or declining kidney function. Excessive liquid intake causes a rapid expansion of total blood volume. Watch what happens to this mechanical pump. The aging human heart experiences the exact same severe mechanical strain when forced to process too much fluid. An overwhelmed heart pumps less efficiently, causing cardiac output to drop. With the heart struggling, the brain is instantly starved of the rich blood flow it needs to function. This creates a brutal paradox. By attempting to force extra water into the body for health, you decrease cerebral perfusion and directly cause cognitive scores to decline. Hitting that 1,500 milliliter target is a highly precise, non-pharmacological medical intervention for the aging mind. Caregivers and older adults should calculate their specific sweet spot based on lean biomass and treat that daily baseline with the same rigor as an essential medication. As you can see in this arrangement, that daily quota includes everything: your morning tea, a bowl of soup at lunch, and water at dinner, all stacked together to reach that 1,500 milliliter mark. Because this relies on lean body mass and cardiovascular health, a doctor needs to individualize the target, especially for anyone with a history of heart failure. Measured hydration enhances the microcirculation inside your brain, while the inverted U-curve proves that excessive, unmeasured drinking will actively wear down your heart and your memory. Defending the brain against cognitive decline doesn't always require a complex pharmaceutical regimen. Sometimes it just requires a perfectly measured pour.